Okay, good afternoon, everybody. Hopefully, everybody's enjoying a little lunch or a little bit of break from work. We got an opportunity to do a great webinar that you have all been asking me about, and we're real pleased to bring it to you. Today, we're going to go over some quick housekeeping items. In the bottom left-hand corner, please feel the ability to chat with us so that we can see what's going on. If you have any questions or concerns, be more than happy to get those answered for you. So that would be fantastic. So if you have any questions, please just put those into the chat box. You'll see the screen change every now and then just to get things set up. But we will the lecture at this particular time. So let's go ahead and get started. My name is Dr. Edward Dickerson. I'm a board-certified facial plastic surgeon and header of and working with my great staff at Cape Fear Aesthetics. And today we're going to be talking about 3D laser hair removal. It's about that time later, and we have more and more individuals who are looking to have the opportunity to get rid of some of that unwanted hair. So let's go ahead and dive in real quick. We're not going to make this long so we can finish up the rest of our day here. So the target for our webinar is essentially melanin. Now that's the natural pigment in our hair follicles as well as our skin. At Cape Fear Aesthetics, we use a pulse diode laser made by Lumenis, and it's at a wavelength of about 800 nanometers. Now that's very important. We're going to talk about that in the future slides because all lasers are not made equal, and we have to make sure that we are using the right wavelength to get the best result. So it's very important for our clients to know wherever they're going that we're using a laser that's going to hit the target. Now most of that pigment is concentrated in the hair shaft or hair bulb. We want to make sure that we have a laser that delivers the energy down to that target area so we can get our best hit rate. And the client who is the best candidate for us is the individual who has light skin and dark hair. The less active pigment that we have in the skin, the less problems we're going to have with the rest of the irritation from the laser, and therefore we're not competing for the melanin, if you will. So that's actually fantastic. This is a picture, a slide of a hair follicle on the left that has not been treated. And you can see that the shaft is intact, the layer of pigment that's going around the hair shaft versus the picture on the right, which has the shaft that has been treated with the laser, and you can see that there already is an involution of the hair shaft. So once again, we talked about which lasers work best for us. We want a longer wavelength, so right around that 800, or in this case 755 in the picture. You can see that it allows for deeper penetration versus the shorter wavelength will not get down to the level of the melanin that's concentrated in the hair shaft, therefore not treating it as well. We also love a larger spot size to cover a larger area, and this allows us to deliver more efficient energy and therefore minimize the likelihood of skin damage. Using the longer wavelength of an 800 or a YAG laser, we're able to treat the darker pigment skin without damaging the superficial surface. And this also allows us to use other comfort techniques. And this laser that we use at Cape Fear Aesthetics we were going to show you how we use vacuum-assisted treatments to facilitate the patient's comfort level. We can also use things like chilling devices, ice, or even cool gel. Here's a picture of the Lumenis LightSheer Duet. You can see that it has two different hand pieces, a smaller handpiece for getting those areas around the lips or the ears, and you can also see the larger handpiece with the picture over to the right, which is about 5 by 3 inches, which allows for a much larger treatment spot size, therefore a much quicker result. This equates to underarms being done in less than 3 minutes. This equates to a back being done in less than 20 minutes. So not only speed, but comfort is going to be very key with our clients. And again, using the longer wavelength and the darker skinned individuals, we're allowed to treat the hair even though that there is less contrast between the hair and the skin. And once again, this client had a fantastic response, only one treatment, and therefore getting response that they would like. Now the next case I want to talk about is those individuals who have shaving profiles or get irritation using a regular razor. And once again, if we get rid of the hair follicle, we can get rid of the irritation. Now, most men do not need to grow a beard below their jawline, and this is where they have their most irritation as well. So once again, laser hair removal is a fantastic opportunity for them to improve their neck irritation. So who's the best candidate? What do we talk about with the clients when they come in? We talk about that there are going to need to be multiple treatments, usually about 3 to 6, especially for those coarser areas like the back. We can have the opportunity for 3 to 6 treatments, usually spaced about anywhere from 4 to 8 weeks apart, depending on how fast the hair is growing. We do not want the client to wax or tweeze between treatments because this removes the target pigment, which would be the hair shaft. It does not allow the laser to have a target to treat. The hair can be shaved and prepped as normally. We do not need long hair like if we're doing waxing. And we will always recommend that the client does not tan because the skin and the melanin is a little bit more active and may absorb the energy of the laser a little bit more readily. It is not a contraindication for getting the laser, but it's something we think about. So what's new? The larger head, which we showed you in the earliest slides, allows us for, once again, quicker treatment. An arm of this nature from the shoulder to the elbow would probably take approximately 5 to 6 minutes aside. There's a vacuum assisted, and we will have a little bit more of a closer view to discuss this. And once again, the speed is fantastic. So let's talk about what's different using the Lumenis Duet. As you can see in the picture to the right, the vacuum will gently draw that area of skin up to the handpiece. This allows a light pressure sensation, and the skin, or in this case the client, will sense the pressure of the vacuum and not the pulse of the laser. And the way that we do this is we confuse the brain that it can only get one sensation at a time. It does not mean that the individual does not feel any of the pulse, but to have that dramatically reduced significantly improves their compliance because of their comfort level. The hair, as we see, is pulled up into the handpiece and is closer to the energy source or the electrodes. Therefore, the melanin is spread out. The targets can be readily seen by the laser, and therefore we can use less energy to target those hair follicles, and therefore less discomfort for the client. Also, the handpiece is lined by a gold layer, and any of those laser energy beams that are reflected off the skin get re-reflected back down into the skin and the hair follicles, once again getting a better treatment area, and therefore the more likelihood of hair growing back. Now, once again, the energy delivery is much more efficient, less sensitive, especially in an area like around the ear. And because of this, there are no topical anesthetics that are required for these treatments. Now, we do have a special offer going around that will be coming soon. And for those individuals who receive my newsletter, you will be seeing an opportunity for you to get 3 treatments of your bikini or your underarm, which is regularly around $450 for 3 treatments. We have a great summer and spring special just in time for Mother's Day, and this will allow the person to get to buy 1 or 2 of these treatment packets for them to facilitate their laser hair removal. Please always have the opportunity to go to our website. For those of you individuals who would love to reserve a appointment, we can be reached at our phone number, 910-323-3757. And one of our fantastic items that we offer our clients at no additional charge, go ahead to your app store, type in Cape Fear Aesthetics, download the app. You will get our updates on our specials, promotions. You can request your appointments online, and please do not forget to share them with your friends. At this point in time, it looks like I have a couple of questions, so I'm going to answer those. Our first question comes, it says, I have rosacea, but I also have excess hair on my face. Can I still get laser hair treatment? The answer is yes. We may have to be a little bit more careful in turning down some of the energy. And that's the great thing about the Lumenis, is that we can dial in that energy for the best thing for the patient. We have another question here. Can I go back to work? Yes, right, immediately available. Those individuals who, let's say, are getting laser hair removal on their underarm, there's a small amount of redness, and that's all it is for essentially the neck or even the bikini area. But once again, we'll have clients do this on their lunch hour. They can apply their makeup readily afterwards. Another question that we have is, I get cold sores. Can I treat around the mouth for some excess hair around the lip? For those individuals who are very sensitive to cold sores, we can prescribe a medication. Some individuals will use pre-treatment medications with some antiviral medication. So know that there is not a contraindication for you to have that treatment. So yeah, that'll be just fine. Another one we have is I've just recently moved to the area, and my last treatment was 6 months. Will I have to go through the entire package? Great question. By coming in and talking to myself or one of my skincare experts, we can give you an idea of what it would take to maximize your results. We can always have those areas purchased just in one session at a time to be cost effective. Well, hey, those are some great questions. It looks like we've answered most of them, especially with our webinar. We're really pleased that you all tuned in, and we look forward to serving you next month. with our webinar, and look forward for a taping of this on our website as well as our next newsletter. Good luck to all of you, and hope you have a great spring.